Good morning and welcome to COVID Talk with our local health authorities. Joining me is Dr. Erica Brown, representing Harris County, Dr. Janita White, representing the City of Houston. Special thanks to our producers, David Castillo, Priscilla Key, and Kathy Finninger, past president, Rotary Club of Houston. I'm Stephen Williams, director of the Houston Health Department. A lot of diverse questions today, so let's just get on it. Of course, water. On Sunday prior to the water boil notice, I drank an enormous amount of water. How long would it take for me to notice any adverse reactions? I'm sure that person didn't have any adverse reactions, but go ahead.
Exactly. So, great question. We did have a boil water notice. It wasn't a do not drink notice or a do not use notice. So just to kind of reference the fact that you shouldn't really have any complications as it relates to infections. But if we were looking at infections in sort of water, there's bacteria, there's parasites, and oftentimes we think, in the medical community, there's things like cholera, giardia, E. coli. These are bugs that we see in water. And so it would range depending on which organism we were really thinking about if that were the issue. And some can be as quickly as a couple of hours. We call explosive kind of diarrheal complaints. And some could be for several weeks. And so a lot of times people say in general, look for symptoms in, 3 to 5 days. If drinking water was contaminated and that was the message that we wanted the community to be most aware of, you would look for symptoms like diarrhea, abdominal pain, cramping, even symptoms such as nausea, vomiting, headaches. Worst case is we call like a jaundice. Your skin turns yellow, or you see yellowing in your eyes. And those are the symptoms to watch for. But in the mindfulness of this also is that if you had those type of symptoms, you really want to see a healthcare provider, because it wouldn't just necessarily have to be waterborne infection that could give you some of those sort of, overarching symptoms, nausea and vomiting, abdominal pain. If you've already sort of swallowed the water that came out of the shower, you brushed your teeth, given our boil notice, really there should be minimal effects. But if you're an infant, if you have medical complications, you're immunocompromised, if you're a young child or elderly person, those would be the signs and symptoms to watch for. And again, that would be abdominal pain, nausea, vomiting, diarrhea, headache, maybe even that yellowing. But again, this was a notice. This wasn't a do not drink, and this wasn't a do not use order.
Okay, but let's be clear that the Public Works actually followed their protocol and process. They put that notice out of abundance of caution.
Absolutely.
That was the case. The all clear alert never said if the water was contaminated at all. Are the recommendations to throw out ice, etc., of any value? I'll answer that. They're recommending that out of abundance of caution. They did not say that the water was contaminated at all, but because that system went down for a couple of hours, they followed their protocol and put out that notice. How many people got sick from the water issue that started on Sunday? There are many questions on this event. We didn't get any complaints, did y'all?
We did not. To my knowledge, we don't have any complaints, but of course we're continuing to monitor.
And I'll say also for the Houston Health Department, we have a surveillance team, our epidemiologists, our unsung heroes. They will continuously monitor. They call it syndromic surveillance. And so they'll be monitoring any concerns if they see GI symptoms or complaints in our hospital settings. And that will trigger us to also make sure that we're informing if there's something that we need the community to understand about this recent notice.
And just to add to that, our environmental inspectors were in contact with all of the restaurants, whatever, giving them advice on what process and procedures to follow. Current status, how would we know that we are in another wave? What's the possibility of a surge? COVID surge.
So we will know we're in another wave when we see our positivity rates go up. But Part of the issue with monitoring that is that there are home tests available for COVID now. So previously we had the ability to see all testing because the only way to be tested was in a provider's office. With home tests, that is not necessarily the case. So fortunately, Houston does a great job with the wastewater testing. So as we continue to monitor, if we see those numbers spike up, that may be an indication that a wave is coming. We are seeing the positivity rates and the numbers in the wastewater go up slightly, but we still are in a low risk climate for now. The other things is we watch hospitalizations and ICU bed admissions. Now, these are retrospective measures, but that is one of the ways in which we can tell whether we are experiencing a spike or a wave. What are the possibilities of a surge? So there's always a possibility of a surge because the virus continues to mutate. Fortunately, the mutations that we're seeing now are what I would call cousins of what we have previously had. And the BA.4/5 vaccine, the booster that we have, has proven to be efficacious. And so that's one of the best ways that we can combat seeing a surge is to go ahead, and if you're not vaccinated, absolutely get vaccinated. If you've been vaccinated and haven't had your booster, to get your boosters. There is enough data out now that does show that these vaccines do help to prevent serious illness and death.
Okay, you answered the next couple of questions. The first,
okay.
Wastewater information, and we can see that now it's gone up from 134% to 196%. Also, positivity rates. And Nina, I'll throw this one at you. New cases are slightly up in Harris County. Any uptick due to parades, athletic events, or whatever?
So again, to the point about the positivity, we see the wastewater slightly increasing, positivity slightly increasing. So I know that individuals, due to these sort of outdoor activities, are being mindful of their preventive measures, masking and vaccinating, like Dr. Brown mentioned. So I think we're not attributing any of these numbers to these large-scale events, but just reminding people that don't let your guard down when you're participating in these kind of events. And if you have symptoms, if you've not been properly, had your vaccine series, it's still important to do those mitigation strategies.
China and Japan. One is totally open, one is closed. Significant lessons learned.
I think the lessons learned is that there's no one answer. It really takes a comprehensive strategy to protect the community from a pandemic. There certainly are times where it's appropriate to close. There certainly are times when it's appropriate to be open and to use all of the available resources to protect the community when we're open. Masks was key and still continues to be key if we feel like we are in a large congregate setting and there's a possibility of spread. Hand washing is key when we're in public places and then amongst our family members as well, because our family members and friends all go out into the public. But the take-home message is that there's no one answer. It really is a comprehensive strategy that depends on the data presentation that we have at the time, and then from there, determining at that point in time, what is the best way to move forward.
CDC seems to be under political pressure. Is Dr. Hotez being stopped from receiving EUA here in the U.S.?
And again, so that feedback was, again, I'm not able to say that he's being stopped from an EUA. I just know that the team that does his team, he's the Dean of Tropical Medicine at Baylor and TCH, they've done great work for global support of having a vaccine that can really, address some of the global disparities that we've noticed. And kudos to them. Again, the vaccine that they developed has that support for halal, which is important for a lot of communities.
And with CDC, they're going through a process just like most health departments in the country. And having experienced a pandemic, there are lessons learned. And so we're really looking at opportunities to increase our capacity to respond. A small number are taking the bivalent booster. How can we analyze the results with such a small sample?
We're certainly not where we want to be with the bivalent booster across the country. And unfortunately, Texas and Harris County, including Houston, are lagging even behind where the country is. So frankly, we need to do a better job. Having said that, though, the CDC was able to do a study of 360,000 patients who did receive the booster to prove the efficacy of the vaccine. So because the country is so populous, even the small last numbers that I saw maybe a week or two ago were 10% uptake of the booster. Even of 10% of such a populous country is enough to do an adequate study.
Cuba only has Sputnik vaccine from China. How effective has that been?
And well, on that one, I am not up to date on the Sputnik vaccine, so I would apologize. I'd have to get back to the person who asked that question.
I know there are a number of questions about how effective the vaccine that was created in China is.
Mm-hmm.
Should people who did not receive vaccines for MMR and other childhood diseases get them now, especially if they are near children?
So I can take that one, Dr. Brown, pediatrician in me. So the pediatrician in me, if you're not up to date, one of the first things we ask in a visit, well, let me go back, translating my pediatrics to adults in general. When you come for your appointment, if you are not up to date on vaccines, the goal is to get up to date on routine vaccinations. Paramount. So I don't care if you're 10 or 40, 50, 80, we're going to ask you about your vaccine. And that's for routine vaccines. And then we ask again the COVID and other, this is flu season, so do you have your flu vaccine? I thought it was interesting that Columbus Public Health Department, right before the holiday, before Thanksgiving, they saw 19 children who had measles, and nearly half of those children ended up being hospitalized over the holiday, and that's terrible. And then almost half of those kids were under the age of 5, so they've not completed their series. So the CDC does say anyone who's had measles at some point in their life should have received 2 doses, should have good vaccination and good protection. But there is a caveat. If you're an adult and you're from 1963 to 1967, you may have received the inactivated MMR. And then for that purpose, you would need to get an additional vaccine. Depending on the information when you're talking to your provider, it may be 1 dose only, or it might be 2. But certainly, we know the MMR is pretty effective, 93% after first dose, and then 97% if you've gotten the complete series.
What is convergence, evolution, and vaccine resistance?
Oh my goodness.
Say that again.
Okay.
Go ahead.
Okay, let me again say I'm going to read my notes on this. Okay. So first of all, the main goal of a virus is to spread as far as it can. And so it'll look for weak spots and take advantage in order to achieve that goal. So for COVID-19, the virus is trying to figure out, just like any other virus, what's the best shape that it can use to survive. And it needs a host, for instance, a human host to survive. So changes in the virus that make the shape stickier or more prone to stay with the host will create a better spreading. And so that, again, that's the purpose of a virus. And so when you have billions of virus particles trying to find the best shape, right, eventually a small number will find the same shape and do it independently of each other. So at first they're all acting as one group trying to figure it out. And then they figure it out and they say, okay, I got it. I'm ready to go off on my own. I'm ready to live on my own. And so mutations tend to occur after that make it spread more easily, because everybody says, okay, well, now I figured it out, and now I can try to do some different things to expand my reach. And so the second thing to consider is that vaccines also train the immune system. Okay. And so the vaccine resistance, though, comes in when you have a well-trained immune system. that is slowing down. A virus is slowing that down, right? So you've been introduced to a virus, the body responds to it, and most oftentimes, right, we recover with no issues. When we have issues, when we feel sick from the flu, when we feel sick from COVID, again, most often we recover and there's no issue, but the body recognizes that this virus, they've been exposed and is able to handle it. When we start to see resistance is when the vaccines and or from exposure through direct inoculation with the virus, we start to see that the body says, this is a little bit different for me. Meaning I saw this virus before, but I'm seeing something a little bit different about it, and I'm not quite sure how to handle it. So we might not get the most response that we had previously seen before. And so since being vaccinated makes your immune system able to act more quickly, the virus has fewer chances to copy. What happens too is with the boosters, that again is another introduction to some of the mutations to remind the body that they're seeing the same thing in essence with a little bit of change, because remember we talked about when the virus gets independent and says, well, now I figured this out. I know how to survive in my host. So now let me make sure that I'm able to stay alive, and it may mutate a little bit. The body needs a reminder of that. And so that's what the boosters are here to do for us, is to make sure that the body is reminded that you've seen this before. It may be a little bit of mutation, maybe a different flavor, but you have seen this before and the body will respond accordingly. I hope I was able to answer that to best of my abilities.
That was a very detailed answer.
Thank you.
Pfizer has a vaccine being tested for RSV. What is the status?
So in August, Pfizer had a press release statement that they were intending to present results of their interim analysis, and they're going to submit for peer review in a scientific journal. The study is called Renoir. It's phase 3, and so that's for adults 60 and older who could get vaccinated. And then Pfizer also announced that they're going to do a study for global maternal immunization trial for a bivalent respiratory virus vaccine candidate. And so that should be coming down the pipeline as well.
Will the vaccine keep you from getting sick?
So currently there is no vaccine. As Dr. White just stated, the hope is that there's something coming down the pike shortly, but there is no vaccine. So the best way to prevent RSV is good hygiene, avoiding close contact with people who are sick. Again, washing hands, covering your nose and your mouth when you're sneezing, when you're coughing. And one of the biggest things that can be helpful is to isolate when you're sick, and especially if you're not sure what is the source of the illness. At the very least, mask up.
Are RSV tests accurate?
Both the PCR and antigen tests are detecting effective methods for RSV infections, and the antigen sensitivity is about 80 to 90%, so similar to our COVID test.
Can you gain immunity to RSV?
Unfortunately, RSV is a virus which, and we just talked about different characteristics. The characteristics of this virus don't afford long-term immunity, so they don't provoke the body to remember for a long time. So it's difficult to gain immunity. Sort of like a common cold. The body sees a cold. You may be one of those who gets a cold every year, and it just is what it is in terms of the body doesn't recognize that it has seen that last year.
New England Journal of Medicine article questioned the benefits of vaccinations amongst previously infected individuals. What is the takeaway?
So that takeaway in that article was just suggesting that hybrid immunity does actually result in conferring stronger protection. So if you've been infected, but you still get your booster, you're going to have stronger protection.
Close Medicine published a study that vaccine effectiveness of primary COVID-19 vaccine series showed natural immunity more effectively protects SARS-CoV-2 reinfection than vaccinations. Is that just any comments? Is that just a statement of fact?
I think that's a statement. That this is what the study published.
Mhm.
APO4 is the strongest genetic factor for Alzheimer's disease. Can you explain this?
So this is another one, have to kind of dive into the data a little bit. This was from NIH Research Matters. They discussed that certain genes can increase the risk of developing dementia, and dementia including Alzheimer's. So they thought one of the risk factors that was most important was the apolipoprotein E gene, APOE4, which is what this question is asking. And it mentioned that about 25% of people carry one copy of this, and that 2 to 3% of people carry 2 copies. But they say that APOE4 is the strongest risk factor gene for Alzheimer's disease, although inheriting it doesn't mean a person will definitely develop Alzheimer's. And so they're just suggesting the reason that the APOE4 increases Alzheimer's risk is still not well understood. So more research to come.
Are there genetic clues for COVID?
So similar to the previous question about Alzheimer's, it does appear, again, through NIH studies that there are genes that, when present, seem to indicate a higher risk of severe infection. Specifically, the ACE2 gene seems to be more associated with a higher risk of infection. There's also genes that have been shown that perhaps protect more against COVID infection, specifically the IFNAR2 gene, perhaps will help to prevent more against morbidity and mortality from COVID. But this is also still being studied.
I tested with one of the ancestry programs and they asked about COVID. There seems to show a connection between Neanderthal DNA and susceptibility to COVID for those not previously infected. Is that true?
So there is some information or research out there. So if they go to the genome sequencing from the National Institutes of Health through the National Genome Research Institute, they talk about the explanation for Neanderthal gene variants. And so that research team did conclude in present day that 2% of the genome comes from Neanderthals. So there's information out there.
BQ subvariant is now dominant in the U.S. and resistant to antibody treatment. Is there any alternative?
So the current monoclonal antibody treatment, that is correct, has not been proven to be efficacious to treat the BQ subvariant. However, as we stated before, the booster is efficacious against the BQ variant. So that is another way in which you can protect yourself.
I've heard the term variant soup with multiple variants all seen together like a cluster of viruses. Is that accurate description? Is that usual?
Well, it's because the current crop of immunity dodging offshoots the Omicron variant is unprecedented in this diversity. It's just, we've never seen anything like this. So this complexity makes it harder for us to really predict the coming waves and then what to do next. So some people do talk about there could be this sense of a double wave because these offshoots are happening, and really the message is the more we can get people vaccinated and the more we can do a better job, like we talked about earlier, that we really haven't done a good job of getting people boosted. You're leaving space for the virus to sort of just really do so many variants, and then we're going to be chasing behind how to best manage the variants and what medications and treatments are effective.
Any insights on whether the flu is presenting stronger this year?
I don't have any insight on whether it's presenting stronger. We are seeing more cases so far, but not necessarily that it's stronger. It's just that we're seeing more cases.
I've just recuperated from the flu. Should I consider getting the flu shot? And if so, when?
So hope you're, hope you're recuperating and your recuperation is going well, and, hope is as speedy as possible. After you see your provider and you've sort of been deemed clear, absolutely you should still get your flu vaccine. We've talked about earlier, there are different strains that we put into a flu vaccine for the anticipated season. This is still, we're still in November. Flu goes until March, sometimes as late as April. If you've got flu B and flu A sort of ticks up later in the season, you may not have adequate protection from just being sick alone. So yes, you should get the flu vaccine when your doctor clears you to get the vaccination.
So if you get the flu shot, can you get reinfected if you get it too soon?
So Yeah, kind of the opposite too. If you get it too soon, especially when we see people older the age of 60, they're supposed to get high dose flu. If you get the flu shot too early, some people want to get it like in July and August, but depending on your health risk factors, you leave yourself potentially not protected maybe late into the season. And again, we're still learning. One of the things we've said on these presentations is, what we know now. So we're seeing the flu season kick up now in November. We don't know what it might look like in March, April, May, right? And so too soon is not a good thing. However, for some individuals, like children who have to get 2 doses, like if you've not had your flu shot, and for children, you're supposed to get a 2-dose vaccine. So then, you might want to think about getting the first dose now because you're going to need that second dose in about a month. So for some individuals, it's the right thing to go ahead and get that vaccine.
I'm concerned about bringing my child to the doctor for a checkup. So with so many viruses circulating in their offices, is telemedicine as effective as in person?
So telemedicine is really an excellent option for certain things. If you have a common cold, things that really we just need to check in and make sure that there are no other signs and symptoms that you do need to come in. However, what we are experiencing and have learned since the COVID pandemic is, unfortunately, we are really behind in our preventive medicine and really behind in our vaccination series for our children, which we've discussed in several different ways throughout this presentation about why it's so important to make sure that our children are vaccinated with their regular immunizations. And obviously those cannot be done through telehealth. And just to make sure that our children are progressing along the normal sequences that they should be. And that can't be done even through telemedicine as well. So preventive medicine is absolutely necessary. It does require an in-person visit. I will say, though, that for certain children who are at risk, it is something to weigh in terms of when. Perhaps it is deferred if you have a child who is immunocompromised or at risk, but it certainly should not be forgotten.
I want to thank you for joining us for COVID-19 Talk with Local Health Authorities. Representing Harris County was Dr. Erica Brown. Representing the City of Houston, Dr. Janita White. Special thanks to past President Kathy Finninger, Rotary Club of Houston, for providing us with these questions, and to our producers, Priscilla Key and David Castillo. I'm Stephen Williams, Director of the Houston Health Department.